Yeah, I ain't no Superman businessman like you. You know, I'm just a gangster, I suppose, and I want my corners.
Three, two, one, zero, ignition, liftoff.
Welcome, welcome, welcome to the Five Corners Podcast. I am Jet Bonifay, and on the other line, he just finished telling me that I shouldn't have eaten all my spam during the first week of the coronavirus lockdown. It's Ace Merluzza. What's up, brother?
What up? What up? Damn Skippy, you shouldn't have eaten all that spam. So, what's new, man? Long time no pod. Anything new happened since we last hopped on the pod? I mean,
Nothing much.
right.
The whole world just shut down, you know? Nothing,
Yep.
nothing big.
Nothing big, among other things.
Yeah, I know. But it's funny because, the last pod we did was on the All-Star game, right?
Yep.
And
Yep.
that feels like 3 years ago.
Yeah. It was a totally different world. We were already talking about what we wanted to talk about next.
I think what made it real for us is that night when we found out that Tom Hanks got it.
Right.
And the NBA, we didn't know at the time, right? But it was Rudy Gobert that had it. And I think that's when it really crystallized for people that this thing is real. And like I said, when we go through the timeline, you realize it's actually pretty late in the game, but that's when it was real, at least for me.
Yeah, and I think Tom Hanks and Rita Wilson's announcement and Rudy Gobert's announcement came in successive nights, right? It kind of felt like it came back to back.
Yeah. Yeah.
And I remember texting you at like, whoa, like what's going on over here? And then everything just escalated quickly after that.
Well, like you said, man, it's one of those things that they don't, we're not projecting it to be that bad, and people are already looking at it like, uh-oh. So people knew, we just didn't take it seriously. I think that has a lot to do with our government, right? So we'll kind of dive into when we reacted versus when the first signs of it first started showing up. So December 21st was the first wave of pneumonia cases in Wuhan. So they had no clue what was causing it. I'm putting that in big ass air quotes, right? Unknown cause. Right now they're saying wet market. Who knows? We don't know. January 11th, the first person died in Wuhan. So that's early 2020. January 20th, the first confirmed cases in countries outside of China, including the US. January 23rd, China shuts down Wuhan, basically isolating it from the rest of the country. The 30th, a week after, the World Health Organization declares a global health emergency. So now we're still in January, by the way. The 31st, Trump restricts travel from China, which again, he's been bandying around as his, measurement of I acted quickly.
China.
A month after, Italy is basically getting pummeled, right? The entire region of Lombardy has their first big surge, and they start locking down the country. Again, a week after the first U.S. death, so this is still February, late February, the first death in Seattle related to COVID-19 occurs. And that's the first time Trump enacts any type of travel restriction. And it's only for the countries Italy, South Korea, and Iran. On the 11th of March, so again, this is now we're in March at this point, this almost the second week of March, Trump finally restricts travel from all European countries with the exception of Great Britain. And then, like we mentioned, we learned that Tom Hanks on the 11th, that same night, has contracted coronavirus with his wife, Rita Wilson, while they're in Australia. They got tested very quickly in Australia, and they were already in a hospital getting treated. That same night or shortly thereafter, we found out from the NBA that they're suspending the rest of the season. And we didn't know at that time, but it was because Rudy Gobert had contracted coronavirus. And then the 13th, Trump finally declares a national emergency. So that was about a month ago. March 15th, the CDC issues the first social distancing rules regarding how many people could be congregating. I think it was less than 50. The 27th, Trump signs the coronavirus stimulus bill that is giving people now the $1,200 stimulus check. And then the 30th, most states are issuing stay-at-home directives. And by most, I mean, basically all of the United States, with the exception of those 7 states that we kind of alluded to earlier. So it seems like a lot, but, it's not a lot of time. I mean, you're talking about the end of December. But again, I think one of the problems was this had already probably had spread to Europe and we just didn't know. And Trump didn't shut down anything until late February, early March.
And New York City, being the tourism hub that it is, obviously attracts a lot of European tourists. And we found out a few weeks ago that a lot of the coronavirus that they feel had made it to New York was from Europe.
Yep.
So
yeah. So I think it's just a telltale sign of, again, the country ignoring science data and the medical experts, right? And Trump going, I know better than everybody, so I'm going on my timeline because it's going to hurt my reelection campaign if I start telling people in January that, oh, there's a deadly pandemic coming around the corner. And I think that makes me nervous because it's kind of endemic of the way he's approaching the rest of what's happening now and what's going to happen when we have to quote unquote open the country, right?
Right.
So thankfully we've got governors, and this is one of the great parts about not being a federalist country, is that local governments generally have more power when it comes to enacting things like lockdowns, school closures, businesses being shut down. That guys like Cuomo, Murphy, Newsom from California all did the right thing early enough, to save lives. I mean, again, there's 200,000 cases in New York, but again, to your point earlier, I think that has a lot to do with, New York being a travel hub. And then obviously everybody that works in New York generally lives in New Jersey. Like you used to work there. I used to work there. My wife still works there. So it's, because it is the first dumping ground, it becomes a hotbed. And literally I said on the last podcast, we're literally on top of each other. I mean,
yep.
Subways,
No way around it.
Yeah. Streets, right? People are walking up and down the street. So I think that was going to be inevitable. But I don't think we acted early enough, because if we did like California did, because my brother had told me 2 weeks before all the lockdowns that they were getting locked down. I was like, for what? And again, hindsight being 2020, those 2 weeks could have probably saved, for New York, at least maybe tens of thousands of lives,
Right.
Thousands of lives at least. So, but yeah, so, I mean, what do you think? I mean, obviously you're in Austin, so it's drastically different from what we're running into now. How has it been there? How does it feel? Are you feeling like it's a pandemic scenario? Because it certainly does here, obviously, because of the amount of, infection, but how does it feel in Austin right now?
It feels like there's a disconnect, and I've probably mentioned to you plenty of times since this broke out that I probably feel more in tune with what's going on back home, right? I probably pay more attention to Governor Cuomo and Governor Murphy's updates more so than Governor Abbott. So out here, everything is spread out, right? And obviously the Capitol is in downtown. We're following all the CDC guidelines. The official stay-at-home work order, quote unquote, stay at home, even though the governor didn't call it that, was issued in March 31st.
Wow.
Yeah. So that's like almost 2 weeks after it was enforced in the East Coast, right?
Right.
But other executive orders were passed prior to that. The orders to limit social gatherings, close restaurants, bars, basically non-essential businesses. But like back home, you could still order takeout, et cetera, et cetera. So I kind of feel that people are compliant, but considering the numbers in comparison to what they may see outside of it, kind of lends itself to a false sense of security. So we're still taking all the precautions. I mean, it's still kind of crazy out there. There's still lines forming outside of grocery stores, although not as crazy as the first few weeks. But compared to what I've seen and have continued to see back home, it's like night and day. It's very
So,
different.
so are you feeling like is there an undercurrent of people like not believing that it's happening? Do you feel that? I mean, again, Austin is a little bit more progressive, I would think, than everywhere else in Texas, right? But what is your sense of the populace that didn't transplant in from other states besides Texas?
Yes, there is an undercurrent, but not so much that I'm experiencing it firsthand. It's basically everything that I'm seeing being reported.
Right.
The protests that happened over the weekend, as far as like interactions I've had with residents out here, doesn't. s- I've never really felt the undercurrent of people that would go against the grain,
Yeah.
so to speak. So
Good. Yeah, at least
yeah.
that's a positive, at least, right? I mean, unlike these other states, but I want to go back to what you mentioned about you're paying attention more to the governors of like New Jersey, New York, right? It's funny. You and I text all the time, and it's become part of our daily routine, right? Now that we're kind of at home, working from home,
Mhm.
turning on the press conference for Cuomo, turning on the press conference for Murphy is so diametrically opposed to what you're hearing from the president, which in a majority of the cases is completely unhinged, right? When he's talking and he's berating
Mhm.
orders, and he's like, he's basically parading on the pulpit in the middle of a pandemic crisis. And I think people are finding comfort and solace in listening to Cuomo because he's actually talking facts. He's mentioning the healthcare impacts, the public health impact, and people are just not getting that from the president. I mean, again, what are you guys seeing? What's the undercurrent there? Are people watching Cuomo there, going like, "Hey, man, this guy actually knows what he's talking about"?
I think it. I think I could only speak for us. I think we've done a good job of staying home for the most part. I
Okay.
mean, and I've told you plenty of times. I only really go out to do things like get the mail, do groceries. But the times I have been out to get said groceries, I've driven past local parks. You know,
Right.
I don't see social distancing being like practiced at all.
Right. Right.
Um, but like I said, I mean, if you looked at our numbers, I mean, if I was anyone else, I'd feel some sense of comfort
Mhm.
because, well, the numbers don't suggest that.
Yeah. Yeah.
I'll get it, but you know, um, better safe than sorry, right? So
You're right. Yeah.
yeah, I mean, we're taking it seriously. I mean, I get notifications from the local mayor here and the mayor of Austin as a whole. Um, so the overall feeling is we're doing a good job. The hospitals aren't being overwhelmed at all. But I think there's always room for improvement. I think people can do better, but it's hard to ignore like the good weather. When the weather is nice, it's kind
Spring.
of hard not to
Spring in
go
Texas.
out and try to enjoy it.
Yeah, yeah,
So
I'm with you, man. I mean, and it's funny because again, back to Cuomo, he was putting up pictures of the Brooklyn flea market, right?
mhm,
The Union Square flea market during one of the nice Saturdays, right? It's just human nature
right,
from a long winter, and it's a nice Saturday in New York City, and
right,
cats are. And again, this is the largest city that has the most amount of infections, and dudes are outside buying like artisanal cheese.
right,
You know what I mean? I mean, so I think there is certainly, there's a group out there, and we all know them as kind of right wing conspiracy nuts, right? There's a group out there that kind of thinks that like, hey, this is overblown. This is probably like the flu, but eh, in the areas like you mentioned, it's really heavily hit. I think people are in general, taking it seriously. So I think that's a positive. Um,
right.
what about and you mentioned it's not too bad from a healthcare standpoint. What about like PPE stuff like that, equipment? Anything that Austin has done in particular, or are they fine?
Well, I can say the hospital bed capacity is such that they have plenty of beds still available. We have 21,000 beds available, 2,400 ICU beds available,
Oh.
more than 8,300 ventilators available. So it's not like we're reaching and we need like
Right.
beds, PPE.
Yeah.
I mean, we still have it in decent supply because we're not overwhelmed. So
How many people? How many? A weird number to go to, but how many people have passed away in Austin thus far because of this?
um 27. So
Really?
yeah.
Wow.
So altogether 1,233 cases were confirmed and
Wow.
27 deaths in Austin. But for Texas as a whole, don't have the numbers for you, but when you're a resident here and you see 27 deaths and then you see
Right.
like deaths in the thousands,
Sure. Sure.
you're like, okay, well, I think we're doing okay so far.
Yeah. Yeah. Yeah.
I think we could be a little complacent, right? For lack of a better word, when
Sure.
we go out, practice social distancing as best as I can because the numbers are what they are, but they're still climbing. The state as a whole, people are still dying every day, but it's just not a considerable spike
Right.
on a day-to-day basis.
Wow.
So
So really, for you, your connection, you and Carl's connection to all of this is back east. Is just the fact that so many people over here that it makes it a little bit more real for you guys. I mean, again, like you said, if I grew up in Austin and I'm like, well, the 27 people died. I don't know how many people died from the flu. You're like, okay, it's terrible, but it's not pandemic level, extinction level proportion type death counts, right?
right, right. And I look at the Texas dashboard for COVID-19, and I look at it for an extra few seconds after it finishes loading, and I'm like, all right, I just finished looking at New Jersey's dashboard,
Right.
you know, which
Yeah.
isn't to say that, oh, okay, I'm good money. The numbers are a lot smaller out here. We're still approaching things like, we're living back home. I mean, the kids have been out of school for well over a month, and they've probably gone out with us for a drive maybe like twice.
Okay.
But at the same time, I see children playing all the time outside, but we choose to stay at home as much as possible.
So what are you doing? Are you mentioned there's still lines. Is that a byproduct of like the stores trying to social distance inside of, because that's what they're doing now here, like ShopRites, Costco's, they don't allow more than, a handful of people at a time to do shopping at any given time.
That enter, maybe 2 weeks ago they didn't. Um, but what a popular local chain here did was that they started closing all their stores at 8 o'clock
Okay.
and reopening at 8 so they could like restock. And for the most part, it's been going very well. Nobody's had any issues finding what they need as
Toilet
far
paper
as food goes.
shortage.
Um, yeah, and toilet paper is fine now, but I think you just can't find any disinfectant spray or wipes. Those are hard to come by.
Right. Sure. Because everybody's kind of like, those are the portable ones. So
Yeah,
the positive aspect of this is, you know, it stinks that all these restaurants are closing. And I think you and I mentioned this, is that like everybody here, at least in Jersey, because Jersey pizza, everybody
hmm
ordering takeout, you know.
hmm
So there's less of a, I think after the first 2 weeks of people trying to hoard all their stuff, they realized, okay, it's not an extinction level event. I don't need to save up enough food, to last me for 4 months. I just have to try to minimize the amount of time I'm actually going to grocery stores and restaurants and whatnot. So
right.
I think that's definitely helping. And like I said, I've eaten way too much takeout, man. Like I probably
You and me both, brother. Hey, I got two words for you: family pack. All right. There's a lot of new like terms that have entered our lexicon in the past month.
right.
Family pack is among them. You know.
Because like you said, it's hard to go buy like healthy, nutritious food, right? 'Cause
Yeah.
you don't want to go out too much and you're trying to, so you're just like, you tell the wife, look, and you justify it, right? Hey, these are
Mhm.
small business restaurants.
We're
I got,
supporting local.
that's right. At the price of my waistline, I'm supporting all my local businesses. Like we got,
Yeah.
cookies, you know, cakes and whatnot from local bakeries. And again, we're trying to do our part, but it's certainly not doing any favors to my waistline, man.
Yeah. I mean, you know the deal with me, man. I'm like all or nothing. It's been tough for me, man, with like the gyms closing. But I gotta get back to it somehow with some stay-at-home type of exercise, and at least be a little more mindful of our macros.
Yeah.
But
It's what people were saying, and this is funny because this is part of like my daily Instagram and social media crawl, right? Like people are like,
mhm,
why are you worrying about your physique right now? You know what I,
nobody. Hats off to anybody that is, and they're staying sharp, but
right? It's tough, man. I mean,
it is.
there's a and I again I talked about it on the last pod that I kind of did. It takes a mental toll on you, at least here, right?
Yeah.
You know what my situation is with my sister, my mom, my brother. So it's difficult to get in the right mindset to like lift weights when you're like, well, my parents could contract this at any time because they
Mhm.
work in New York and they live in New Jersey. Um, so like I said, it's like I told you, it's difficult to get myself in a position to like lift weights. I haven't wanted to lift weights, which is kind of weird.
Same here, man. But I have wanted to do something to get the heart rate up. And um, maybe 3 weeks ago, I was like, oh, maybe I could start running outside. And then they started recommending wearing masks more. And I'm like, okay, I guess I shouldn't run. Well, I apparently could, but we're
And again, that's part of
yeah,
the problem. There's so much conflicting information, right? First,
right,
you don't need to wear masks, right?
right,
And
right.
like, well, if you're sick, wear a mask. Or
Hmm.
if you have symptoms, you wear a mask. Then now they're
Hmm.
like, well, maybe everybody should wear a mask. So I think all the conflicting information, all the different sources is confusing the hell out of people. And I
Right.
think that's part of the problem of like having a president who is kind of off the cuff, who
Mm.
talks shit when he's up in the pulpit and he's just kind of winging stuff. And it's difficult because people want factual data and they're
Right.
not getting it. I mean, this is a perfect example of that. Like something as simple as should you wear masks during this pandemic?
Right.
They flip-flopped over it, quite a few times before landing on, you know what, maybe everybody should be rocking masks. That probably makes sense.
Right. And you could go outside and exercise, but maintain social distancing. Let me tell you, you'd have to go to some desolate field and run because you're more than likely 100% going to run across someone. And you're definitely not going to be 6 feet away from them when you run across somebody else going the opposite direction.
Sure, sure.
Unless you like make a
Yeah, beeline
like
away. Yeah.
beeline away,
Yeah.
but that's really tough to do.
Well, it's funny. We have Jason walk the dog, and that's what
Mhm.
we tell him to do. Like if there's somebody's walking on the same sidewalk as you, make a beeline in the other direction. But it's hard to do, right? You know, it's hard to maintain that all the time. So okay, we're talking about food. Anything else that's been suffering for you as part of this pandemic?
Yeah, I mean, my hair is getting longer. I'm X pounds heavier. I mean, we're sleeping in more, losing sense of what day it is, and that's everybody, right? I mean, days are really framed by my work schedule.
It's tough. Um,
I mean,
it is. It's
yeah.
one of those things, like you said. Again, we're lucky, right? We're lucky that we get to work from home and make money working from home. So, don't flame us. This is us talking about us being in a lucky position, but you end up working more. You end up, you leave the laptop open and I told you yesterday I was answering emails to like damn near 11 o'clock at night because it's
Yeah.
just around and you don't know how to unplug. And then to the point about like you wake up like right before your first meeting, right?
Mhm. Yeah.
The
Yeah.
kid,
10 minutes before.
right? And then the kids kind of follow suit. They wake up when you wake up. So everybody's
Yeah.
schedule just starts kind of adapting to one another. It's kind of this weird hive mind thing that's happening right now.
Yeah.
crazy, right?
Yeah, it's a trip, man. I mean, as you know, I started a new job beginning of March, right? And I was going to the office. The kids were adjusting to a routine of getting to school earlier,
Right.
right? And Carl's would pick them up because I was going into an office. And then 2 weeks after starting, guess what? I'm back to working from home. And a big part of the reason why I like moved on to another company was, well, like you said, when you work from home, work never really leaves you.
Oh, it never
And
stopped.
so I went from working 100% remote to going to an office for all but 2 weeks, and then the rest is history.
It's funny that
Here we are.
yeah, it's funny that misconception about like, hey, you're working from home. That should be cool, right? Like all you're doing is watching. It's harder. You know,
Yeah,
on top of that, right? Because again, props to
yeah,
teachers, daycare employees, all of the people that again we just take for granted. When you're having to work from home in the
mhm,
job that you and I do, and then
right,
having to ensure that kids are fed, clothed, bathed, all of the normal, it just adds this extra layer of stress where you're just like, hold on, I have a very important 1 hour conference call. I can't
mhm.
have kids running screaming in my hallways. You know what I mean?
Right, right,
You're
right.
constantly like, my wife has had to resort to, going into the closet to make sure that,
A
nobody,
lot of people are doing that, right? They're going into the closet now for conference calls.
I mean, it's the
It's
most soundproof, portion of the house is my closet.
yeah,
She's,
right.
every time there's an important call, just head to the closet. So
Head to the closet.
it's tough, man. And again, we're
Yeah,
lucky. So again, I'm not complaining, right? Obviously, healthcare workers, frontline employees, essential employees, people that are making it happen out there in the streets every day, 100%
right,
props to them, right? That's like I said, it's Herculean. They're doing God's work. A lot of them, they have no choice, right? They work, unfortunately, on an hourly wage basis, so it's not like a salary, so they have to be out there.
right.
So I'm just saying, specifically to us, it's kind of like that first world problems deal where it's just like, man, it's tough to be doing this stuff.
Yeah, yeah, and we have a lot of people that are very close to us that are on the front line. So that also adds to our daily concern, as you know. Um, but that's another story, right?
Yeah, yeah. I mean,
Yeah,
let's talk about that a little bit. I guess it's one of those things that when we were growing up, it was kind of like it was implied if you're not going to go into like engineering or accounting as typical Filipino parents, they're just like, okay, default status is nursing.
hmm,
Now you're kind of like, oh man, that is a that's a tough job. I don't know if I could do this job. Right? I mean, I never thought I could do the job to begin with, let alone in a pandemic environment where and I'm telling you, man, some of the horror stories that my mom, my brother are telling me, I'm just like, I would be like, maybe I'm not going to work this month and a half. Again, going back to I'm a coward and they're superheroes type thing, but I don't know if I could face that every day.
fortunately, I only follow up with my sister, but I kind of feel if one relative is going through whatever it is,
Right.
everyone else is going through the same thing. So I get updates from here and there. I mean, obviously, some share on social.
Right.
I mean, you see people posting pictures of themselves wearing their PPE, and if they're willing, they share some stories. But yeah, it's rough out there. So you're right. Hats off to them. They're doing God's work. Um, I think what this does is it makes us more grateful for our healthcare workers and what they do.
And I think every day it becomes a new appreciation, right? It becomes, like I said,
Yeah,
we were getting stories about people not being able to talk to their loved ones during their final moments, right?
yeah,
Scrambling to
yeah.
have iPads just so they could do like a FaceTime call before the person passed away. That type of stuff
Right.
is like, to me, is like the most heartbreaking part. So, given all that, and again, Austin's different, Texas is different, but what are your thoughts now on a lot of these governors though saying, hey, it's time to open. It's we need America back, baby.
Well, I mean, that's part of the reason why people were protesting downtown over the weekend at the state capitol, right? So my whole thing is, I mean, their fundamental values of firearm defended, self-reliance, individual rights over community, it doesn't work well
Mm.
during a pandemic here, in my opinion, right? So when their fundamental values are threatened, and more, and these are folks that put more weight on facts and stats, then you get what you get this past weekend, protests. So
Right.
um I mean, I've seen reports of they're having discussions about reopening, and I think the governor here has already announced that retail businesses will reopen on the 24th. So
Oh, wow.
I don't know what kind of plans are in place to roll that out, but I'm not going to be visiting any retail businesses.
Yeah.
I'm still going to stay at home as much as possible.
Yeah,
So
it's funny. I've been joking about it on social media, but like the Georgia governor is going to open up nail salons, tattoo parlors, bowling alleys, gyms, right? And you go, oh, okay, well, you know, your infection count is still rising. How do how do you socially distance in a tattoo parlor,
right.
in a nail salon? How do you do that, right? I mean, in shit, and even in a gym, how do you social distance, right? I mean, I
You
guess
can't.
you can be conscientious,
Impossible.
right?
Yeah.
Guys
Mhm.
are constantly, they're sweaty, they're grabbing weights, and we know that this thing can live on surfaces for up to 2 to 3 days. Who knows who's actually cleaning these, supplies or whatever the case may be? It's That's a bad deal. Like, and this goes back to, there's a political undercurrent, and let's be perfectly frank. A lot of it is probably racially motivated, right? It's like, well, it's happening to them, to those
Mhm.
people over there, to the
Right.
progressive states that have a lot more people of color. It's not going to happen to us, right?
Right.
So, and then they hear it. They hear, well, the Black African, African American, Latino community are the ones that are dying from this. And they're kind of like, okay, well, that's not me. It's not representative of my race. So I guess I'm good. To the point you're making about, they think their rights are being infringed on. It's because the data that they're hearing doesn't reflect their own society, the reality that they live in. So I think that's hurting the cause. Right?
It is. It is. And but the numbers, I mean, they're not as high as anywhere else, but the trend is such that, it's still increasing every day,
Right.
and if you were to go back to living life the way we were, um, going to a green belt, right? Enjoying the lake, the many parks here, it could very easily turn into something really bad. So we just got to keep at it. It's just not something you should start to roll out like immediately. So I hope whatever plans they have to reopen retail businesses first, and whatever else that'll follow suit, that they'll have a thought out plan that will be rolled out in phases, gradually. And it seems like they're all in on it, despite of my disagreement over it. But we can only control what we could control, and we choose to stay home for as long as we see fit, and practice social distancing
Right.
when we do go out, and those moments are few and far between.
So what do you think we're gonna do? We're gonna have to do to move on from what this is.
Yeah, I mean, that's the toughest question to answer, right? I mean,
Yeah.
I think we're constantly tuning into the news to see what the next steps are. So,
Yeah, I was having this conversation with my wife, and I said, okay, there's only two ways to go about this, right?
mhm,
Unless there's a miracle vaccine that shows up tomorrow, which we know is not going to happen because it has to go through rigorous clinical trialing, right?
right,
You are going to have to test a copious amount of people, and not just once. And I was telling Lizelle this. I was like, here's the problem. The incubation period for this thing, we know, is anywhere between 5 to 14 days. So let's say I test you today and you show up negative, right?
Mhm.
It doesn't stop you from contracting it tomorrow and then 2 weeks from now being positive again, right?
Right.
So, for example, my workplace is an office environment, right? We have
Right.
conference rooms, and sure, we can socially distance, but unless you're, and here's the other problem is it's a majority are mild or asymptomatic, so you
Mm.
be walking around. You're not going to the hospital if you have a cold, right? And again, this is not saying it's like a cold, but let's say you have a slight fever. Your first thought is not going to be, oh shit, I have coronavirus, right?
Mhm.
You'd be like, all right, I'm going to take a couple of Tylenols. I should be fine. Unbeknownst to you, you have coronavirus because it could present itself that way, right? And
Mhm.
like I told you before, what stops my kid who goes to school? Let's say we open schools. Let's say back in come next September, comes back home. He's asymptomatic, kisses grandma and grandpa, and then they catch it, and it becomes a more dire circumstance. I think that's my fear is that
Mhm.
without consistent testing and without surveillance testing, I guess is the way I'm trying to put it.
Mhm.
How do you go back to normal? Like I mentioned before, how do we go back to stadiums, dude? You know,
Yeah.
when the NFL starts, what do you do when people are
Mm.
trying to get into 70,000 person stadiums?
Yeah.
You
Yeah.
know,
How do we go to water parks, right?
how do you go to water park? How do you go to Disney World?
How do you go to Disney World? The American Dream
Yeah,
just opened up, like, I don't know, 4 months ago.
right,
They
right.
had that they had that big water park, their amusement park.
Yeah, the
I
snow.
mean,
Yeah,
like, you know what? No one has said enough about the American Dream. All right, that thing took forever to open up. Right,
and then the
huge.
opens, right?
It's huge. It
Huge.
has a amusement park, it has a water park, it has a huge ski slope, and now this happens. And
Right.
then whenever we get out of this, I mean, what are they going to do to
Yeah,
fill that place up?
might be the most cursed retail
Yeah,
spot ever in the face of humanity, right? Like
yeah, it really is, man.
it was mired in construction delays. Now all of a sudden, oh, a pandemic hits the year that you're supposed to open. That's
Exactly, yeah.
hilarious. Um,
But
yeah, you're right on all those counts. What do you do? And like you mentioned, it's such a part of American life
mhm,
doing all those things, right? Imagine a summer where people don't go to water parks.
I
People can't.
can't.
Yeah, like you said, people can't even stop themselves from going to the park with other people.
Right.
Imagine when it's a July or August
Well,
hot day, right?
well, we're gonna find out soon enough, right? I mean,
Yeah, that's a good point. And I think that's the part that scares me is that
right.
people we live in America. We have liberties and it's the beauty of being an American, right? You have all these liberties you can take whenever you want, however you feel like it. And I think uh, unless you're in a scenario like New York and New Jersey where morgues are filling up, you're not going to take it as seriously. And you're going to say it's cool to go to the tattoo parlor. It's okay to go to water parks. And I think, like you said, the next few months are going to dictate what's going to happen over the next couple of years, right? People were
Mhm.
saying, and again, I don't take too much stock into it right now, but people in South Korea are retesting positive after they.
Right.
So there's a question about how much immunity do you actually get even when you do get it. So all of those things kind of swirl around in my head. And like I said, I have some comorbidities and the fact that I have asthma, my son's got asthma. So it's a little tougher, but I don't know what we do as a country after this, but
Yeah, and I don't know about you, but I haven't seen enough reports about, any advances in, testing, um, vaccines, and whatever else. And that's what I'd like to learn more about. Like, where are we in regards to pushing out more tests and getting in a vaccine expedited?
well,
So,
I gotta big up the alma mater real quick
yes, sir.
because we did get the
The,
saliva
s- the
test.
saliva test. There you go.
So I'm all jerseyed out. I got Drazen and I got Derek right here. I wish it was Kenny Anderson, but it's Derek Coleman and Drazen. So I'm jerseyed out today because I'm representing that. But yeah, you're right. I mean, unless there's an easy take home, you do it, you put it in the mailbox, it comes back. What do you do? So
Right.
you know, but I agree. You also can't, you know, at some point you also can't keep doing this. You can't lock up Americans, right? It just needs.
Hmm.
But you know, my contention is always I don't think people are listening enough to the science and the math, and they're not following medical experts. Like I'm cool with like, hey, to your point about Austin not having this many, okay, maybe it makes sense to open up retail spots until we start seeing a spike, and then we say, you know what, maybe that was a bad idea. I just don't know if people are motivated that way. I'm hoping they are, but you know, based on what I'm seeing, man, I don't see it that way, and
Yeah.
kind of terrifying.
And right. Yeah, and we don't hear much about like other states, right? I mean, you hear about Georgia, you hear about the Floridas of the world. I mean, what about Kansas, Nebraska? You know, what how about those other like middle America states? You know, where how are the numbers there? I mean, how are they following the guidelines? Um, are they achieving the goal of flattening the curve? I mean, will they ever like experience a situation where their hospitals will be overwhelmed?
I
We
think
don't know that.
I think one of the positives about these types of states
Hmm.
is that they saw a model like New York, California, New Jersey, and they were able to do all the right things that New York, New Jersey wasn't able to do, which is they were able to contact trace, they were able to find the people that were getting sick, test them,
Hmm.
and then find all of the people that they came in contact with. And because these are more sparsely populated states, it's easier to do. Cuomo today was saying he would have to hire thousands upon thousands of contact tracing employees
Hmm.
try to implement that same type of protocol in New York City once this thing is done, right?
Right.
Because of the sheer numbers of New York City. Like imagine if they were to call you when you used to work downtown, Ace, and go, "Hey, we know you're sick. Can you tell me all the people that you ran into today?" You'd be like, 5% of them are complete strangers. I don't know who they are. They were on a subway with me, right?
Yeah. Yep.
So it really, I think what we're speaking to is a tale of multiple countries within a country. New York is a completely different country than Middle America.
Hmm.
California is a completely different country than, you know. So it's a bunch of countries within the United States that's kind of operating with a completely different dynamic of population, density, all of those things that kind of make this thing spread easily or slowly.
Hmm.
And the health departments need to be aware of that. And I think they're doing a good job in Middle America because number one, they knew this is happening. Number two, there's less people, and per capita, they probably have more doctors just because there's less people. So
Right.
yeah,
Yeah. The first confirmed cases that I remember hearing about back in February, right towards the end of February, the first presumptive like positive cases of the coronavirus was travel related.
right.
You know, so I think it starts from there.
Yeah, and then you got to wonder, and again, this kind of speaks to Middle America, right? How many people from Middle America are flying to China
Hmm.
or going to Spain or Italy? Or I mean, not to say that they're not, but
Hmm.
on a per capita basis, number one, they have less immigrant population, right?
Right.
And number
Right.
two, they're probably a little less worldly. I mean, I know I'm making a generalization, but in general, more metropolitan cities are more apt to travel to different countries, and I think that's kind of showing itself in here. You know, Chicago, you know, California, LA, San Francisco, New York City, New Jersey are all very multicultural states and cities.
Hmm.
I think, you know, Des Moines or Akron, I think there's
Hmm.
less of that, right? It's less worldly. There's less immigration. So
Don't tell LeBron that about Akron.
Ron, he's sitting in his mansion playing horse, watching the
Right.
MJ documentary, going, "Damn, this guy one up me
Yeah.
on my legacy again."
Right.
All right, man. Okay, I think this is obviously not going to be the last time we talk about coronavirus, but I think
Right.
it's going to be less centered around specifically like what's happening, but more, you know, what it's kind of impacting in the world of sports. And, you know, we mentioned talking about fitness and, you know, the parenting. So we'll delve more deeply into that. Um, but I think it's going to change our world, right? This is going to be a new normal from now on, kind of like what happened after 9/11, um, and everything just completely changed, at least for us.
Yeah.
That happened. I think this is another one of those moments in history where everything changes after this. Nothing will ever be the same after we get out of this, whenever we get out of this.
Yeah, and I just keep on thinking back to January and February when we were talking about getting this up and running and what we wanted to talk about.
Right.
Our whole mindset was different, right?
Absolutely.
Like we were like approaching life so much different
Yeah.
than we are now. And you know what? I was supposed to go back home in a few weeks, man.
I know. We were
You
remember we were
know?
talking about we're gonna have this pod in person,
Yeah,
right? And we could just record in person. Now it's
right. Now it's like,
though.
all right, I don't know when I'm gonna be coming back home now. So
Yeah, it's
see,
crazy. And like I said, we were my wife and I for our anniversary. We're in Barcelona, right? Like
that's right.
2 weeks
Yeah,
before the shit hit the fan. We were in the crowded Las Ramblas, walking around, and to see these places, New York City, Barcelona, Italy, all of these places completely empty and devoid of people is
yeah,
is insane. I've never seen that. So,
right.
like I said, it's going to change the way our lives are going to be lived moving forward.
Mhm.
I just don't know to what extent, right?
Yeah,
Don't know, like, how long this is going to be. I guess it depends on whenever we get the vaccine. So
yeah. We are punting 2020. It's we're just like taking 2020 and just punting it.
yeah, hopefully I'll see you in October, but we have no clue. You
No
have
clue. Nope. Yeah.
your coverage, and we're in 2021. With that.
Yeah.
And
We'll see.
the worst part about it is specifically for you and I is
Yeah.
both turn. Well, I turned 40. You're about to turn 40, right? So this
Yeah.
will be a big year for us in terms of like, hey, kicking off a new decade. In your 40s, it's supposed to be like, supposedly now the new 30s. So like all of that, it was just I was so angry. I kind of posted.
Yeah.
Up.
Yeah, man. I was already looking for places where I could have a bunch of people gather just to meet up and say, hey, for my birthday, the big 40.
Yeah, yeah,
Like Rodizio somewhere for like people I'm closest to, Fernandez and the Ironbound. Now I don't even know if I'd want to go there even after all of this is done. You know
yeah.
what I mean?
Yeah, and that's the other part, right? It,
Yeah,
it now damages your psyche.
yeah,
How do you go back to, you bring up a great point. How do you take your kids back to an amusement park or to, Kalahari or, whatever, Disney World? How do you do that? Mentally, you're just going to be like, I'm super, super sketch now. You don't know until there's a cure or there's at least a treatment, right?
right.
'Cause-
And there's definitely going to be a lot of measures introduced moving forward once we get past that cure phase, right? Once,
Sure.
if at all. So
Yeah. Yeah, we were we
yeah,
were,
this,
we were joking like, what are you going to take everybody's temperature as they walk into the Madison Square Garden?
yeah,
Like,
pretty
is
much.
that part of the protocol? Like, I'm going to scan you, make sure you're below 98.6.
Yep.
So,
And like walking through a disinfectant tunnel,
right,
right?
where they
Like with your arms spread out.
instead of like the liquid, or the ice, the smoke ice or whatever, it's
Yep.
disinfectants.
Yep.
Oh my God,
That's yeah.
it's going to be sad. So, like I said, I'm hoping this is this is the best I've felt in a little bit, which is always a plus because it's dark. It gets dark, especially when you're in the house. The weather hasn't been great here, so it's been like cloudy, and you're inside the crib.
Mhm.
You can go to dark places and that. So, um, the pod definitely suffered. Obviously, we weren't recording anything, but I just was not in the mood. I'm sure you were not in the mood as well.
I wasn't. I wasn't. I think we were about to, and then something happened.
Right.
And then I was just like, okay, this sucks.
Yeah.
Like
It just everything sucks right now.
everything just sucks right now. I don't want to do anything, but I think we've thrown around the idea of wanting to do it, and I think we needed to do it because I think it's nice to air things like this out.
Right.
And I'm sure our friends listening want to listen in on our conversations as well. So happy to be back.
All right, man. All right. We'll see you guys next time. It'll be a much lighter conversation, we promise. We're probably going to do the MJ doc, probably the NFL draft, right?
Yep, definitely doing Last Dance stuff.
Doing Last Dance.
Definitely got to do Last Dance stuff.
That's compelling, man. It's the only sports on television right now.
It is. You know, that's all the sports talkies are talking about.
Digging up the past. Everybody is trying to profiteer off of my nostalgia, right? Everybody,
Yeah.
Everything now is like the remake of Final Fantasy, Animal Crossing again. This.
Right.
It's just like, yeah, sure, keep profiting off, but we need it. It's like comfort food, it's mac and cheese. So, all right, guys, we'll see you next time. We appreciate it. Thanks a lot.
Peace.